Regional One Health, Elvis Presley Trauma Center is one of the 5 busiest trauma centers in the country. We see a multitude of patients, a multitude of injuries.
I had a left broken collarbone.
My husband was injured in a fall.
I had a little cousin who suffered a very bad burn injury.
The bullet entered the right side and came out of the left side.
Broken eye, broken face, broken jaw. I knocked out 5 teeth.
It is the reality that these things can happen. On September 23rd, there was a mass shooting that occurred in Collierville at Kroger, and we got the call early on. I actually received the call directly from our medical director, Dr. Peter Fisher, and we sprung into action. We've been preparing for that day, unfortunately, for a long time. Got the call that several individuals were injured. As we all know, the initial calls are not always accurate, but we mobilized the team.
We're the only level 1 trauma center in a 150-mile region.
And so everything comes to us.
What is unique to our trauma center is we have yet to see the influx that many other trauma centers have seen of the level 2s, level 3s, and the other trauma centers that surround it. We're one of the top 5 busiest trauma centers in the country. We maintain a penetrating index of greater than 25%.
We get patients from all walks of life.
And on a busy day, it's not uncommon for us to get 15 to 20 shock trauma 1s, which is our highest level of trauma activation. That will mix anywhere from gunshot wounds to stab wounds to a variety of car accidents, a couple falls with bad hemodynamic compromise, and the tractor that rolled over somebody in a rural environment.
You get very complex blunt trauma patients. They are transferred in from 3 to 4 surrounding states.
We have that ability, no matter what the injury is to be prepared to treat and care for that patient.
The pioneering work that was done by Dr. Tim Fabian when he started the program in the early 80s, and then the addition of Dr. Martin Kroos, their work not only set the standard here in the Mid-South, but really the entire world. And so it was that pioneering work that drew me back to be able to be part of that and to build on those pioneering roots that we had. A really unique setup here where it's pretty much all contained in the same area that allows for great transitions of care as we move our patients through the system from the shock trauma rooms that we're standing in right now to the areas for imaging, for CAT scans and MRIs, right into the trauma operating room, right into the trauma ICU is really a unique setup that only exists in a few places in the country.
Our trauma registry is a database used to capture information regarding care of critically injured patients. Much of the data abstracted is used for ongoing research. It includes data from before, during, and after a patient's arrival to the Elvis Presley Trauma Center. The fact that Regional One Health can provide this patient's full continuum of care contributes to this patient's outcome. The Trauma Center is not about all data and all numbers. These are actual people. That's someone's mother, someone's father, someone's sister. That could be your family member.
It can be a difficult job. I mean, you see a lot of sick people and you have to tell families a lot of bad news. It's, pretty special to have someone come back and thank you for the care you provide.
I'd say thank you, because if it wasn't for them, I wouldn't be who I am today.
And when you go through an injury like this that you're so close to death, you walk around realizing how close you are to the end of it. Thank you. Y'all are great at what you do, and we're very lucky to have you.
Because of you, I'm here today. I honestly believe that if I went to any other hospital, I wouldn't be here today.
I mean, it is the fruits of their labor, and it's the care and attention that started me on this journey of recovery. That should have been my final day, but it was the beginning of a new day.
Someone has to care. That's why I do it. That's why I'm here at Regional 1, because of the people that we serve. It takes a whole team effort to get the job done, and that includes physicians, highly trained surgeons, nurses that are specialized in trauma and ICU care, environmental services, physical therapists, respiratory therapists, and the list can go on and on and on. It takes a multi-D team.
When we have a patient that has presented to us, the most critical patient, and we find that that patient actually survived, that patient was sent to rehab, and that patient went back home, that means that what we put in place, those trauma handbooks, those nights and weekends, those weekdays that we worked so hard, that lets us know that evidence-based practice is real, that loop closure does exist, and that we're doing the very best thing that we can do for all patients.